Most people with diabetes focus only on carbs and insulin. But what if the real secret to better blood sugar is in 3 simple vitamins you're probably not getting enough of? In this video, we will reveal the top 3 vitamins every diabetic should take to help lower blood sugar and protect against complications. Managing diabetes isn't just about cutting carbs or taking meds. It's also about giving your body the right nutrients to function better. Today we'll break down how vitamin B6, vitamin E and vitamin C can support blood sugar control, protect your nerves and even improve insulin sensitivity. Whether you're newly diagnosed or just looking for better results, this could be a game changer. Let's get into it. If you're interested in this topic, type I am ready right now. Just comment, I am ready. When I see your comment, I'll give you a heart. And if you want to help the channel, please leave a like and subscribe. It takes less than a second and help the channel a lot. Vitamin B6, the nerve protector. Let's begin with vitamin B6, also known as pyridoxine, a vitamin that often doesn't get the spotlight it deserves, but is absolutely essential for individuals managing diabetes. Why? Because it directly impacts several processes that are crucial for controlling blood sugar and preventing complications. First, let's talk about how it helps your body manage carbohydrates. Vitamin B6 plays a central role in glucose metabolism. It acts as a coenzyme in various enzymatic reactions involved in breaking down glycogen, the stored form of glucose in your liver and muscles, into glucose, which your body can use for energy. This makes it easier for your body to regulate blood sugar levels, especially after meals. Research has shown that low levels of vitamin B6 are commonly found in people with poorly controlled diabetes, and deficiency may contribute to unstable blood sugar patterns. But the benefits go beyond sugar processing. Vitamin B6 is crucial for nerve health. People with diabetes are at high risk of developing diabetic neuropathy, a type of nerve damage caused by high blood sugar over time. This condition often begins with tingling or numbness in the feet and hands and can progress to sharp pain, burning sensations and even loss of balance or mobility. B6 helps protect the nerves by supporting the synthesis of neurotransmitters, chemical messengers like serotonin and dopamine, that are essential for proper nerve signaling and brain function. Additionally, B6 has an important role in reducing homocysteine, an amino acid in the blood that when elevated can damage blood vessels and increase the risk of cardiovascular disease. This is particularly relevant for diabetics who already have an elevated risk of heart complications. By helping to lower homocysteine levels, vitamin B6 may indirectly protect the heart and arteries. Interestingly, some emerging research also suggests that B6 may enhance insulin sensitivity, the body's ability to respond to insulin properly. In people with insulin resistance, the cells don't respond well to insulin, leading to higher blood sugar. B6 might improve how cells take in and use glucose, although more human studies are needed to confirm this effect. So, where can you get vitamin B6? It's found naturally in a wide range of foods. Chicken, turkey, salmon and tuna are excellent sources. For plant-based options, try bananas, spinach, sweet potatoes, avocados and fortified cereals. Even chickpeas and other legumes are good sources. However, many people don't get enough through food alone, especially those with certain medical conditions, poor diets or long-term diabetes. That's where supplements can come in handy. But here's the caveat. While B6 is water-soluble and excess amounts are usually excreted through urine, taking too much, especially in supplement form, can be harmful. High doses over a long period have been linked to nerve toxicity, ironically causing numbness or tingling, similar to the symptoms it aims to prevent. For most adults, the recommended daily intake is around 1.3 to 2 mgs, but therapeutic doses for specific issues may be higher. Always consult your healthcare provider first. In summary, vitamin B6 does more than just aid metabolism. It acts as a nerve protector, an inflammation fighter, and potentially an insulin sensitizer. For people with diabetes, especially those dealing with nerve pain or blood sugar swings, ensuring adequate B6 intake might be a small but powerful step toward better health. Comment, I'm all for protecting my nerves with vitamin B6. If you believe this vitamin is essential for nerve health and blood sugar control. Vitamin E, the antioxidant shield. Next up is vitamin E, a fat-soluble nutrient known for its incredible antioxidant properties, and it's especially beneficial for people managing diabetes. While it often flies under the radar in mainstream discussions, this vitamin can play a surprisingly powerful role in improving overall health, stabilizing blood sugar, and reducing the risk of long-term diabetic complications. One of the biggest threats to people with diabetes is something called oxidative stress. When blood sugar levels remain elevated, the body starts producing excessive amounts of free radicals, unstable molecules that attack healthy cells, damage tissues, and contribute to inflammation. Over time, this constant oxidative stress can accelerate the development of chronic conditions like heart disease, kidney failure, nerve damage, and retinopathy, damage to the eye. This is where vitamin E steps in as a frontline defender. Vitamin E works by neutralizing free radicals before they can wreak havoc. It acts like a cellular bodyguard, protecting the integrity of your cells and preventing damage to your blood vessels, organs, and nerves. This is crucial because oxidative damage is a key contributor to nearly every major complication associated with diabetes. But vitamin E's benefits don't stop there. It may also directly influence blood sugar control. Studies suggest that it can enhance insulin sensitivity, which means your body's cells respond more effectively to insulin. When insulin works properly, it helps transport glucose from the bloodstream into your cells, where it can be used for energy. Improved insulin sensitivity means lower blood glucose levels, reduced insulin resistance, and more stable energy levels throughout the day. Vitamin E also plays a role in improving cardiovascular health, which is especially critical for diabetics who are at greater risk of heart attacks and strokes. It can help prevent atherosclerosis, a condition where plaque builds up in the arteries, causing them to harden and narrow. This can lead to high blood pressure, poor circulation, and ultimately life-threatening cardiovascular events. Vitamin E helps reduce inflammation within the blood vessels and prevents the oxidation of LDL cholesterol, a process that contributes directly to plaque buildup. In addition to its protective roles, vitamin E supports immune function, helps maintain healthy skin, and promotes better circulation. Factors that become increasingly important in people with diabetes who may suffer from delayed wound healing or poor peripheral blood flow. When it comes to dietary sources, vitamin E is abundant in nuts and seeds like almonds, sunflower seeds, and hazelnuts. It's also found in leafy greens such as spinach and Swiss chard, as well as vegetable oils, avocados, and wheat germ. Including these foods regularly in your meals can provide a steady, natural supply of this crucial antioxidant. However, for individuals who aren't getting enough through food or who are dealing with significant oxidative stress, supplementation may be helpful. In fact, several studies have shown that vitamin E supplements can improve glycemic control in people with type 2 diabetes. But as with anything, balance is essential. Because it's fat-soluble, excess vitamin E is stored in the body and not easily excreted. Taking too much can interfere with blood clotting and increase the risk of bleeding, especially if you're already on blood thinners or have a bleeding disorder. Most experts recommend staying within the safe upper limit of 1000 mg, 1500 IU per day from all sources. As always, it's best to consult with a healthcare provider before starting any supplement, particularly if you're managing a chronic condition. In summary, vitamin E acts as an antioxidant shield, defending your body from internal damage, improving how your body uses insulin, and reducing the risk of serious complications. For people with diabetes, getting enough of this powerful vitamin is a smart, proactive step toward long-term health. Comment "Vitamin E is my shield" if you believe in the power of antioxidants to protect your body and stabilize blood sugar. Vitamin C, the blood sugar stabilizer. Last but far from least is vitamin C, a powerhouse nutrient that most people associate with fighting off colds or boosting the immune system. But when it comes to diabetes, vitamin C plays a much bigger and often overlooked role in protecting your body and managing blood sugar levels. In fact, its impact goes beyond immunity, making it one of the most important vitamins for diabetics to consider. Let's start with how vitamin C helps stabilize blood sugar. One of the ways it does this is by reducing oxidative stress, a harmful process that occurs when there are too many free radicals, unstable molecules that damage cells, in the body. In diabetics, high blood sugar levels can dramatically increase oxidative stress, leading to inflammation, insulin resistance, and damage to tissues and organs. Vitamin C acts as an antioxidant, neutralizing those free radicals and helping restore balance. But its benefits don't stop there. Research has shown that high blood glucose levels actually deplete your body's vitamin C stores. That means the more uncontrolled your diabetes is, the less vitamin C your body retains. It's a vicious cycle. Low vitamin C contributes to poor glucose metabolism, and poor glucose control depletes even more of this essential nutrient. Supplementing with vitamin C may help improve insulin function, making your body more responsive to insulin and allowing glucose to move more efficiently into your cells. Over time, this can lead to a reduction in HbA1c levels, a key marker used to assess long-term blood sugar control. One particularly impressive benefit of vitamin C for diabetics is its ability to reduce sorbitol buildup. Sorbitol is a sugar alcohol that the body creates from glucose when blood sugar levels are too high. Unfortunately, sorbitol can accumulate inside cells, especially in the eyes, nerves and kidneys, and cause significant damage. This buildup is closely linked to diabetic complications such as retinopathy, neuropathy and nephropathy. By helping lower glucose levels and reducing sorbitol formation, vitamin C offers a layer of protection against these complications. Vitamin C is also essential for collagen production, which helps maintain healthy skin, blood vessels and connective tissues. For diabetics who experience slow wound healing, a common issue due to poor circulation and higher infection risk, vitamin C can support faster recovery and stronger tissue repair. In addition, this vitamin contributes to stronger blood vessels, which helps lower the risk of vascular problems like high blood pressure and peripheral artery disease, both common concerns for people with diabetes. Getting enough vitamin C through food is very possible. It's abundant in citrus fruits like oranges, lemons, and grapefruits. It's also found in strawberries, bell peppers, broccoli, kiwi, tomatoes and Brussels sprouts. Including these foods regularly in your diet can help keep your vitamin C levels steady and naturally support your blood sugar goals. However, during periods of stress, illness or poor diet, when your body uses up vitamin C more quickly, supplementation may be necessary. Fortunately, vitamin C is water-soluble, meaning any excess is usually excreted in urine, making it generally safe for daily use. Still, it's a good idea to stick to recommended doses, typically around 500 to 1,000 milligrams per day for therapeutic effects in diabetics. And consult your healthcare provider before adding supplements to your routine. In short, vitamin C is more than just an immune booster. It's a blood sugar stabilizer, a tissue healer, and a complication fighter. For those living with diabetes, ensuring adequate intake of this vital nutrient could make a significant difference in both short-term glucose control and long-term health outcomes. Comment vitamin C for stable blood sugar if you believe in the power of this nutrient to fight inflammation and help manage blood sugar levels. If this video helped you, give it a like, share it with others, and don't forget to subscribe for more simple science-backed health tips. Thanks for watching, and remember, small changes can lead to big results.